In Ethiopia, Epidemiology and Laboratory Training Program has enabled more than 800 field epidemiologists, an achievement that placed the country close to meeting the Global Health Security Force targets. Currently offered in 8 universities, the globally accredited initiative has continued to strengthen the country's public health workforce. According to the program executive director Assegid, the program plays a critical role in preparing field epidemiologists to tackle emerging health threats, disease outbreak, and public health emergencies by producing adequate workforce that support emergency surveillance, management, and response systems. Unlike many countries where such programs are heavily dependent on foreign donors, Ethiopia has taken full ownership, ensuring the program's stability even in turbulent financial times, he revealed.
The government of Ethiopia is, very much committed to support the Ethiopian Philippine training program. One of the unique features of the Ethiopian government is the government is the one owning this program. In most of the countries, this program is solely dependent on donors. So we have as currently there are lots of global change, especially in terms of financing. Most of the countries are facing challenge. But here in Ethiopia, because the government is the one owning this program, I think the program looks sustainable. So that's one of the commitment. The other thing is the program is resource intensive. It requires vehicles, it requires budgetary support. So the government already deployed more than 42 vehicles to support the practicum training. So that's the commitment of the government. In terms of budget, we are also providing financial support to conduct investigation, surveillance, data analysis to the regional firms and other stakeholders. So the government is the pioneer in running this program.
The training program's impact extends beyond workforce development with over 4,000 policy-informing research projects. The executive director stressed that Ethiopia's approach is a model for others.
Actually, a remarkable milestone I can say we have achieved through this program. The first one is we were able to train more than 800 field epidemiologists in the country. So when you compare this number with the global health security agenda, we are almost done with the field epidemiology to public health workforce ratio. So that's one of the successes. The other thing is we have conducted more than 4,000 researches with this program. These researches are not only researches which we can shelf it in books, but the different thing is these researches inform the policy decision. These researches inform the public health management. This research inform the public health emergency management and surveillance issues of the country. So I can say this program is impactful in creating a very competent workforce. Not only that, but in averting some of the public health challenges we are facing these days and in the upcoming years. Quality is very critical in this program because what we produce must address the challenges of the community. So in order to do that, the professionals has to be qualified enough and competent enough to respond to the challenges of the public health of the 21st century. So for that, what we are doing is we are collaborating with academic institutions. So the program has resident advisors in each university that the Ministry of Health already deployed. There are academic mentors who are routinely following the academic performance of the residents or the students. There are mentors who are actually observing the day-to-day deliberations of the residents. So this helps us to improve the quality as well as to produce competent workforce. This is the overall management of the program. There is also a regular review of the program. So we regularly, annually review the challenge, the best experience and issues that we bring to government attention.
With strong links to international partners like CDC and World Health Organization, Ethiopia's program is not only building national resilience but also contributing to regional and global health security, he noted.